Hi, my name is Dr. Tanumay Raychaudhury and I'm a dermatologist working in Sydney, Australia. I've worked for several years in India, especially West Bengal and Mumbai, and I would like to tell you today about triple combination creams. Triple combination creams were essentially first described by a doctor called Dr. Kligman in the US. What he did was he combined three different products. He used tretinoin, hydroquinone, and a low potency steroid called dexamethasone. And what he was trying to do was he had the thought that the hydroquinone, which is a bleaching agent, would stop the melanin from being formed. He wanted to use tretinoin, which would create pores and enable penetration of the drug. And he wanted to use a steroid that would help prevent the irritation that tretinoin could cause. Now, what has happened over the years is we have been modifying that Kligman's regime in various ways, and this has been something that has been used rampantly for conditions that have pigmentary problems or problems like melasma, especially in India. Now, the issue that you need to understand here is when we prescribe patients these kind of products, there are three things to be kept in mind. One is tretinoin can be an irritant and it can increase photosensitivity, which means you can have skin peeling, skin burning, and it can be detrimental for your skin when left on for too long. The second problem that we face is hydroquinone. Hydroquinone, when used for a few days, gives you a bleaching effect. Patients tend to like that and they keep on using it, and that can give you several problems, including they can have hydroquinone deposition in the skin, which we call exogenous ochronosis, which can make the pigmentation worse. This happens when you use it for several months. The other problem that can happen is hydroquinone is known to be a carcinogenic product, which means it can potentially lead to cancer, and that's the reason why it has been banned in countries such as Europe, European countries, and countries like Australia or Japan. The third problem is using a steroid. When you're using a steroid, especially if it is a mid-potent or high-potent or super-potent steroid, it can cause thinning of the skin, it can damage your skin, and you can have pimples or acne. You can have redness of the face, or telangiectasias, or broken blood vessels on the face, and it can also lead to increased facial hair. It can be used for a few weeks, usually we say 3 to 6 weeks. But the problem is often patients will tend to keep using it because they see that they get an immediate fairness to their skin, and when they keep on using it, it actually can be dangerous. So triple combinations may not be necessarily the best way to treat your skin, especially if you're doing it. Do it under the supervision of a dermatologist and be sure to use it only for the number of weeks or number of days as advised. Please do not do it on your own, and please do not recommend it to people who might be your friends or relatives because they might not know how to use and when to use. Also important to know that and remember that tretinoin is a drug that we should not be using in women who are likely to be pregnant because it can harm the fetus severely. So there are lots of things to be kept in mind. Go to your dermatologist before you decide what cream you're going to put on your skin. Be aware, and that's the best thing to do. Best of luck.